Elizabeth Osikena. I live in Lagos State, Nigeria. I have a great testimony to share today. I had a problem in 2021. I was diagnosed with fatty liver disease and also kidney infection. The problem persisted. I could not walk. They had to hold me. I could not eat. All what I was able to do before, I could not do them any longer. So I went from one hospital to the other. I went to teaching hospital. They carried out different tests on me. It was still the same problem, fatty liver disease and fatty liver and kidney infections. So when they admitted me in the hospital, they bombarded me with antibiotics. My liver became worse. The condition became worse. I didn't know what to do. Even when I went back to the hospital to complain to them, they said there's nothing I can do again, that I have to manage the liver. I said, how am I going to be managing this kind of problem? So what the hospital were waiting for is for me to start having liver failure. Then they will now refer me to outside the country for liver transplants. Where will I be able to get such money from? And even if I have the money, it's something that is 50-50. The risk involved is another thing else. So I went online searching for solution to my problem. So when I was searching online, I came across Rita. I came across Dr. Rita. So I picked her number online and I booked the consultation section with her. During the consultation section, I told her everything I'm having, the problem I'm having. Then she asked me to upload my result to her and send. Let her check. She went through the results. In fact, the consultation section was another miracle on its own. Immediately after the consultation, I was a little bit relieved because she took her time to ask me even questions that they did not ask me in the hospital. Dr. Rita took her time to attend to me. The consultation section, that was when I started receiving healing. I was relieved. Then after this consultation section, she placed me on therapy for some weeks. So I started taking this medication. Immediately after 1 week of that treatment, I've not finished my dose, but immediately after 1 week, I became relieved. All the symptoms I was having before, I was not having them again. The pains, nothing, I was feeling anything. It was just like a magic. I asked my people, I told my people that all the pains I'm having, I became okay. I started walking normal. I started doing all the things I was not doing before. I said, wow. I could not hold it to myself. I have to call Dr. Rita on phone. And I told her that it's like I'm okay. She said I should go and do another test to confirm it very well again. I went to do another test. The test shows that my alkaline phosphate that was very high before, alkaline phosphate became normal. Everything, both the kidney infection, there was no kidney infection again. My kidney became normal. Everything became perfectly okay. I said, what? This is wonderful. This is a miracle. After the therapy, I could not keep it to could not hold it to myself again. In fact, I started searching for people that have similar problems. I started searching for people that have issues. I went to my church and I told them, anybody that I know before that were telling me I have high blood pressure, I have diabetes, I have cancer, I will tell them, what are you doing about it? They will say, doctor placed me on medication. No, they say I have to take so drugs for my life. I will take it for a lifetime. I say, what are you taking medication for lifetime when there is solution to your problem? Google, I will just tell them, Google Reese herb and fruit and book the consultation section with her. Book the consultation section with Dr. Rita. You will see the wonders of God in your life. Because when my problem started, I thought it was a spiritual problem. I have a roommate in school then. She called me that she was having breast cancer. I referred her to Dr. Rita. I said, book consultation section with her. You will see that your problem will be solved. That was how my friend booked consultation section with Dr. Rita. And today, Dr. Rita placed her on therapy and she became okay. Everything is okay. My neighbor too was having high blood pressure and diabetes. She booked consultation section with Dr. Rita, and she became okay. Everything in her system became normal. That is how I started telling my colleagues, everybody, do you know about Dr. Rita? Do you know about Reese fruit and herb? Go and Google Reese fruit and herb. You will see that your problem will be solved. Why will you lie down in the hospital and the doctor will be telling you your problem, you don't have solution, you have to be treating for lifetime, you have to, don't you know that even the medications you are taking is not okay? It's not healthy to you. It's not healthy to your health. You'll be taking antibiotics or here and there, antibiotics every day when there is solution to your problem. There is total cure. I tell people total and permanent healing. Total and permanent cure to your.
Why is like the shake? Yeah. We are live already.
I live in Lagos State, Nigeria. I have a great testimony to share today. I had a problem in 2021. I was diagnosed with fatty liver disease and also kidney infection. The problem persisted. I could not walk. They have to hold me. I could not eat. All what I was able to do before, I could not do them any longer. So I went from one hospital to the other. I went to teaching hospital. They carried out different tests on me. It was still the same problem, fatty liver disease and fatty liver and kidney infections. So when they admitted me in the hospital, they bombarded me with antibiotics. My liver became worse. The condition became worse. I didn't know what to do. Even when I went back to the hospital to complain to them, they said there's nothing I can do again, that I have to manage the liver. I said, how am I going to be managing this kind of problem? So what the hospital were waiting for is for me to start having liver failure. Then they will now refer me to outside the country for liver transplants. Where will I be able to get such money from? And even if I have the money, it's something that is 50-50. The risk involved is another thing else. So I went online searching for solutions to my problem. So when I was searching online, I came across Rita. I came across Dr. Rita. So I picked her number online and I booked the consultation section with her. During the consultation section, I told her everything I'm having, the problem I'm having. Then she asked me to upload my results to her and send. Let her check. She went through the results. In fact, the consultation section was another miracle on its own. Immediately after the consultation, I was a little bit relieved because she took her time to ask me even questions that they did not ask me in the hospital. Dr. Rita took her time to attend to me. The consultation section, that was when I started receiving healing. I was relieved. Then after this consultation section, she placed me on therapy for some weeks. So I started taking this medication. Immediately after 1 week of that treatment, I've not finished my dose, but immediately after 1 week, I became relieved. All the symptoms I was having before, I was not having them again. The pains, nothing, I was not feeling anything. It was just like a magic. I asked my people, I told my people that all the pains I'm having, I became okay. I started walking normal. I started doing all the things I was not doing before. I said, wow. I could not hold it to myself. I have to call Dr. Rita on phone. And I told her that it's like I'm okay. She said I should go and do another test to confirm it very well again. I went to to do another test. The test shows that my alkaline phosphate that was very high before, alkaline phosphate became normal. Everything, both the kidney infection, there was no kidney infection again. My kidney became normal. Everything became perfectly okay. I said, what? This is wonderful. This is a miracle. After the therapy, I could not keep it to, I could not hold it to myself again. In fact, I started searching for people that have similar problems. I started searching for people that have issues. I went to my church and I told them, anybody that I know before that were telling me I have high blood pressure, I have diabetes, I have cancer, I will tell them, what are you doing about it? They will say, Doctor.
Ask Dr. Rita show today on YouTube. We're live on YouTube, we're live on Instagram, we're live on Google Meet, just to make sure that we reach as many people as possible. This promises to be a very interesting and rewarding time for you. My name is Dr. Rita Jabin. I am a naturopathic doctor. I've been practicing for the past 11 years. I'm a graduate of the Phoenix Institute of Herbal Medicine and Acupuncture in Arizona, where I studied herbal medicine. And then I came to Nigeria and I studied naturopathy. And I've been practicing since, and I've handled quite a number of cases. So I welcome you to this session where I'm going to be talking about herbs. I'm also going to be talking about the safe ways to use herbs. And I'm going to be talking about how to use herbs to reverse chronic illnesses. So I believe that this meeting is one of the best meetings that you would have attended in 2025. Now, what are herbs? What is the difference between herbs and vegetables? Because I think that's the starting point for me to start this evening. Because if you need to know how to safely use something, you need to be able to know what it is first of all. So herbs are strongly flavored plants, parts of the plants, and because they are, when you say herbs, basically they are strongly flavored plants, while vegetables are less flavored plants and they serve as bulk. So the difference between herbs and vegetable is that herbs are highly flavored, and they are, because they are highly flavored, they have to be used in very little quantities, while vegetables are less flavored and they provide bulk. So what are examples of herbs? I will just mention some of them. Herbs like eucalyptus, herbs like thyme, basil, these are herbs. Vegetables like carrots, vegetables like um, carrots, broccoli, cauliflower, cauliflower, um, all those your vegetables, your celery, your spinach, those are vegetables. They are less flavored. Now, and so they are usually safe to be consumed in large quantities, whether they are eaten in raw forms or they are eaten in um, in steamed forms. But for herbs are not supposed to be taken in bulk. Herbs are supposed to be used in very little quantity. Now, you must understand that every plant has, so maybe before I even go into that, let me talk about the nutritional facts about plants, especially herbs. Herbs have 0.6 gram of fat, zero saturated fat, zero cholesterol. So plants do not give you cholesterol actually. So that myth and that misconception that, oh no, you do not get, plants do not contain cholesterol. There's no plant that has cholesterol. The plants have about 4 milligram of sodium, potassium, 295 milligram of potassium. Total carbohydrates in herbs, I'm talking about herbs now, are 2.7, general all herbs. Dietary fibers as 1.6. Now, if you look at, then they are very rich in vitamin C, iron, vitamin B, magnesium, and calcium. So these are some of the nutritional facts about herbs. For vegetables, some vegetables I don't, because different vegetables have different nutritional makeup. I'm not going to be going to all, but generally for vegetables and for herbs usually herbs have more condensed micronutrients than vegetables. But whether vegetables, whether herbs, they are beneficial for the health. Now, where there is issue is that people consume a lot of the herbs as against consuming very little quantity. Like I said herbs are those plants that have very high in flavoid, and they are very high. They are very high in flavoid, and so because they are high in flavoid, they should be taken in very little quantity. The issue is that people take the herbs that are supposed to be taken in little quantity, they take them in bulk, they take them every day, they take them in large quantity, and then they begin to experience the side effects from plants. In the last 5 to 10 years, you will agree with me that the rate of liver related problems, kidney related problems is on the rise. Last year, 2023 into 2024, I did a study in the University of Lagos, and this study was done by the ACADAS. This is the sponsored by the World Health Organization. Anyway, they were that department in the University of Lagos is looking at plants, looking at the therapeutic effects of plants, and then also it was the study, the department were also looking at cytotoxicity from plants, meaning that plants that have the ability to cause cancers, and then plants that have the ability to cause liver related problems. And there are quite a number of common plants in the kitchen that contribute to this. You also find out that in the recent time, people are experiencing resistance to diabetic drugs, resistance to hypertensive drugs. This resistance is some of the things that have been isolated, among many other things, some of the things that have been isolated to be contributing to this are the use of too much of spices, herbs. We cook our jollof rice, we add spice. We make our meat, we add spice. The compound effect over a period of 1 year, 2 years, 3 years, 4 years begin to cause side effects. Now, because attention is not drawn to plants, attention is not drawn to herbs, attention is not drawn to vegetables, we look far without looking at these little things that have contributory effects. Now, I welcome everyone from all the platforms you are watching me from. Today, I'm talking about safe and effective ways to use herbs. And also, I'm talking about how to reverse chronic illnesses using plants. My name is Dr. Rita Jabin, and I welcome again. I've talked about plants. So, what are the things that people do that makes them have the side? First of all, before we go to that, I want to say to you that every plant has what you know as the toxic load. Every plant has its toxic load. When you consume plants within their safe quantity and for the safe duration, you may not experience the toxic load. But when you take plants over a period, when you take a plant, a vegetable, a herb over a period of time, you begin to step into the toxic load. And because you are not aware of the significant toxicity effect that a plant will have, you may not know that your mint leaf you are drinking and putting inside your glass of water that you drink every day is what is causing your cholesterol levels not to be normal. So in the last 5 years, we've had cases where a lot of people now are coming down with fatty liver disease. There are two categories of fatty liver disease. There is the alcoholic fatty liver disease, which is as a result of consumption of alcohol or smoking. And then there's the non-alcoholic or the metabolic fatty liver disease, which is not as a result of smoking or drinking. This is as a result of eating disorder. Now, in the last 5 months, if I want to do an analysis of the number of people who have seen me for fatty liver disease and kidney related problems, if I say that I do 100 consultations, I'm telling you that 55% of those people who have consulted with me in the last 3 months are suffering from stage 1, stage 2, stage 3 fatty liver disease. The remaining 45% or 35 or 40% of them have kidney related problems. Now, when I look at their history, they don't smoke, they don't drink, and they are manifesting symptoms that are even worse than people who smoke and drink. So, what are we finding? We are finding that people in a bid to want to be healthy, in a bid to want to live a healthy lifestyle, turn to plants and do it indiscriminately and do it without guidance and do it with Dr. Google and use Google and then Google their way into a more serious problem. And that's why I'm having this health talk today. That's why I'm telling you today about safe ways to use plants. And I'm also creating a sensitivity and an awareness that don't be deceived. Plants have toxicity. Plants have side effects. And the side effect of plants is that they can cause damage to the organs and they can cause irreversible damages very quickly, especially when you now add wrong lifestyle to it. They cause the damages to be fast and to be quick. So, what are you supposed to do? You're supposed to know now. So, what are the safe ways to use herbs? First of all, you need to understand that herbs in the form that you are taking them are known as their crude form. Crude form meaning that they have not been regulated. Example, you pluck bitter leaf from your compound. That is the crude form of taking bitter leaf. You buy mints from supermarket or parsley or any of the vegetables that you decide to use. I hope I'm still there. Or any of the disciple, I say disciple, any of the vegetables. I'm not live again. Am I live? Please, can you hear me? Am I still there? On Google. Please, are you still hearing me? It went off. On Google Meet, it went off. Lost your connection, trying to reconnect. So sorry, I'm trying to reconnect back on Google Meet. There are people there. Okay. Yes, okay, thank you very much. So, all right, thank you, sir. You can hear me okay. Thank you. So I was talking about how people use um how people use drugs indiscriminately. So, what are the safe ways to use herbs? Because that's what the theme of this meeting is about. Number one, I was talking about that every herb that you are taking in your compound. So there are plants that serve as both herbs and serve as vegetables. Example of such plants are plants like bitter leaf. Bitter leaf is not in the same category as carrot. Bitter leaf is not the same in the same category as um, it's not the same category as water leaf or spinach. The flavonoid component in bitter leaf is so high that the indiscriminate use of bitter leaf can cause significant impact on your liver. Bitter leaf is a very good plant. It is one of the best plants. It is anti-diabetic, it is hepatoprotective, meaning to say that it is something that can help your insulin levels, your sugar levels, it can help your liver. It's an antimicrobial, it's high as an antibiotic. However, am I muted? Oh dear, sorry. Can you hear me now? Okay, I'm so sorry. You've not been hearing me. I'm sorry. Okay, so I was talking about bitter leaf. I said bitter leaf is both a herb and a vegetable. So you can have bitter leaf in the bulk form, but if you're going to take bitter leaf as a herb, you need to understand that the thing with herb, the rule, the principle of using herb is that very little quantity is what is required. But when you are using a plant for vegetable, you can use it for the purpose of bulk. Now, for a plant like bitter leaf, if you do not apply caution in bitter leaf, it can easily cause you to have problems in your liver. It can easily cause you to have abnormal sugar levels, even though it has the ability to help your sugar levels. It is a bitter leaf is one of the plants that is a hypoglycemic plant. That is a plant that can help to bring down your sugar level. But you must know how to use bitter leaf. You must know what quantity to use in bitter leaf. You must know when to stop using the plant. These are factors that can make a plant to be safe. So for you to say that a plant is safe, you must be able to know quantity that you need to use, duration of use, timing of use. Safe ways to use plants. Another point I'm going to give to you is this. You cannot be doing combination of plants. When you do 2 or 3 plants, because you didn't study plants, because you do not know plants, there's what you call herb interaction, herb to herb interaction, herb to drug interaction, herb to food interaction. There are some herbs that when you take them with some food, the food increases the actions of that herb that will cause you to have an unwanted side effect. But you will not attribute it to the plant. You will most likely attribute it to the food. So therefore, it is advised the therapy should be done in the morning before food. You have to wake up and it should be used warm. So those things that you will go and grind a bowl of just pluck 5, 6, 7 leaves, you just grind them together and you are drinking. So I've seen patients who have come to me with liver problem, and by the time I'm taking consultation, I'm trying to look at what have they done that have contributed to the problem, because every disease, there is a disease that is as a result of external force. Then there's a disease that your contributing factor, and that's what consultation with me does. It helps me to find out what did you do that is a contributing factor to this problem. And they're also known as obstacles to cure. If obstacles to cure are not identified, the cure cannot be successful, the cure cannot be permanent. So if you want to use plants to reverse chronic issues, you must identify what are the obstacles to cure. It is very important. So you must know that you cannot combine 2 plants together. So the one that you grind pawpaw leaf, bitter leaf, that you want to treat malaria. No. You are already playing into toxicity. And because you do not know what the toxicity effect will be, you cannot tell that headache you are having is as a result of the dongoyaro leaf, bitter leaf, pawpaw, moringa. By the way, let me tell you, I told you I did a study in the University of Lagos. I'm telling you this now. You can go and verify. Don't go to Google. Go and look at research. And one of the places you can find medical research that has been done, scientific research, I'm talking stories that you are finding. These are studies that have been done. You can get to the National Library of Medicine. You need to subscribe to have access to some of these things I'm saying to you. But you will find out that from the study that I did with the University of Lagos, it was identified that moringa leaf, moringa plant is a cytotoxic plant. That is to say, my dear brethren, that moringa is a plant that has an ability to cause a genetic mutation that can cause someone to become cancerous. And there are studies and there are people who have developed cancer from too much consumption of moringa. It is a beautiful plant, and there is no plant in itself that is bad. It is when you do not know when to stop, what to combine it with, So I was talking about plant to plant interaction. I was talking about plant to food interaction. I was talking about plant to drug interaction. These three interactions can cause someone to have a deleterious effect from the use of a plant. Plants are good. I'm a naturopathic doctor. I only use plants. I don't prescribe any chemical drug for anybody. But this knowledge is how, from where I take my prescription from. So I'm telling you about safe ways to use plants. So you don't combine two plants together. If you're going to use plants, you need to take the plant in the morning before food, usually between 6 a.m. and 7 a.m. You give 1 hour interval between that plant and anything that you're going to consume. So you cannot leave. Mint is in the category of aromatic herbs. Aromatic herbs are on another level. The level of compounds, the level of flavonoid compound in aromatic plants are much more higher than even just general herbs. So a plant like mint is not the same thing as a plant like basil. It's not the same thing as a plant like oregano. It's not the same thing as, these are different types of plants. Then you have a plant like golden seal, a plant like echinacea. These are very high level plants. They have very high compounds. Their alkaloid levels are very high. While alkaloids can help us to cause cellular changes, they can cause benefits in our body. Excess consumption of alkaloids has been linked to cases of bone inflammation, has been linked to cases of low immunity, has been linked to cases of low blood cells, low blood volume, because you are playing out of the safe zone. So I'm going to say to you that in trying to use herbs, you must make sure that the herbs you are using it in the morning before you use any other thing. You must be 1 hour interval between that herb and anything that you're taking. And then also, I must say here, please do not give herbs to children less than 12 years old. Why do I say that? Because most of the times you are doing folk remedy, home remedy. And this home remedy, you have not taken time to do study to find out what the dosage is, what the duration is, you've not done a lot of study. So it is safe for you to not give it to children less than 12 years. And before you tell me that our grandfather and grandmother used to give it, the time of our grandfather and our grandmother is not the same time now. What you are eating then, what they were eating then and what you are eating now, the lifestyle, the amount of stress, the hormonal changes, the level of hormones in the diets that we are consuming, they are not the same anymore. So we are not in the plants now. Now plants, in another webinar, I'm going to talk about how to identify vegetables, safe vegetables, because a lot of the vegetables we have in the market now, they are loaded with fertilizers. This in itself is a contributory factor to why someone will have problem from you. So before you start feeling overwhelmed, so what are we going to eat? This is supposed to provide you with knowledge to make accurate choices. And let me just say, this is by the way, any herb or vegetable that you get, that you put inside water to rinse it, how would you know a good vegetable, a good herb for you to use? Because if we're talking about safety of herbs, then you must be able to identify a safe herb. When you put that herb inside water, the color of your water must not change. For instance, if you get mint and you are rinsing your mint or your basil or any of the plants, it should not change. The water can be dirty, especially if it is fresh one that you are getting. The water can be dirty, but the water should not change color and become colorful, like maybe become greenish, When they are becoming greenish, especially when you are dealing with fresh herbs now, please note that it is the fertilizers. That's one of the things. I also did a study at the Federal University of Agriculture on organic plants in Abeokuta here. And these were some of the things that were identified as some of the risk right now, the health risk of vegetables, of plants, of herbs. So how do people identify it? Your cucumber, for instance, when you cut your cucumber open, there are different species of cucumber, yes, but the flesh of your cucumber should not be green, it should be white. The outside can be green, but the flesh should be white. By the time your cucumber flesh It's the same thing as the outside. It's green all through. Please know that you are just taking the nitrogen or whatever it is that they use to boost it to make it fresh to come to the market. Another safe thing you want to look at is any vegetable that you find that ants did not eat anything, it's just looking so big. That is not a healthy vegetable. That is not a healthy herb. You see, ants will not eat anything that has any of all those things. No, ants, insects will not eat it. Well, I'm not saying you go and eat insect-loaded vegetables or plants. I'm saying to you that you should try as much as possible to ensure that you do this. These are litmus tests to put you on the safe side. When I talk about hormones, how to identify animals with that are over that the hormonal levels are more than normal, I also give that. But for today, this webinar for today is safe and effective ways to use plants and how to use plants to reverse chronic diseases or to treat yourself. Now, so I've been talking about safe ways to use plants. I said, do not give plants to people who are children who are less than 12 years old. And I explained to you that our generation is different from our older generation. So at this moment, I want to talk to you about my live physical consultation that is coming up in Lagos on the 30th of January, 31st of January, and on the 1st of February. It is a physical consultation where if you have kidney-related problems, kidney health complaints, really, I will be in Lagos physically, and you can book for your consultation session. It's advisable that you book ahead of time, so you just come in for your time without having to waste so much time and without having to wait for so long. So there are numbers that are dropped right now. You can just please call the numbers and book your consultation session. 30 minutes consultation session with me is enough for us to get you on the path of wellness. You don't even have to have any health issues to come and see me. You may just want to take your knowledge into another level. You may have some other questions that I may not be able to take at this time. You need to come and see me. I am not a roadside herbalist. I'm trained and I know what I'm saying and I can help you, and I've helped a lot of people. So now back to the program, back to what I'm talking about. I'll talk more about the program as we go on. So how do you use herbs to reverse chronic illnesses? First of all, you must identify what is the problem that you are having. Let's use two common conditions that people have: diabetes and hypertension. These are very two common problems. And people are on drugs for a long period of time and they often want to stay off drugs. Are there blood pressure? Yes, there are plants that can help to maintain your blood pressure. Are there diets that can help to maintain your blood pressure? Yes, there's a DASH diet, which is the dietary approach to stopping hypertension. So there are diets, there's a food plan that if you follow the food plan, that food is supposed to help the combination of all those food is supposed to help you to help your heart, which is the organ that is responsible for pushing blood around. What you monitor is the force of blood passing through your arteries. So this diet is supposed to help the heart, help the push of blood, and over a period of time, you find out that your blood pressure can be regulated. In the case of diabetes, the same thing. There's dietary approach to stop or reversing diabetes, particularly type 2 diabetes. Type 2 diabetes is the adult onset diabetes, not the child onset diabetes. This is the case where the person was not born as a diabetic, but along the line, the body is not either recognizing insulin or using insulin or properly metabolizing insulin. And so, yes, so dietary approach. And I've helped a lot of people. Now, if you want to use a plant to reverse chronic ailments, the first thing you want to take note is that you must know how to prevent you getting into the toxicity or the toxic load. And I've told you how to do that. The second thing you need to do is that you need to monitor your vitals. You cannot want to use plants you need to understand that because you want to use plants, is the more reason you cannot afford to be careless. You cannot afford to put yourself at risk. So I find a case where people want to be off diabetic drugs, but they don't want to check their sugar level every day. I'm like, you're not ready. You just want to lazy around and look for an alternative that will do the work they are supposed to do. And I will tell you something. When you go to the hospital and they tell you, be on this drug for life, don't stop taking it. It's not because there are no other options. It's because You don't want to be put at a risk that when you now go and you are not taking your drugs, you are not monitoring, you are not putting yourself at a risk. And then I find those sets of people who just say, oh, I just left my drug. I just left the drug. I'm not using the doctor told me that I'm diabetic and I did not use the drug. The doctor told me that I'm hypertensive. I did not use my hypertensive drug. The complication of hypertension over a period of time will lead to enlarged heart. The further complication of that will lead to kidney failure, kidney disease. This is not it is just as it is. So if you want to reverse hypertension using natural means, you then must be willing to do the work involved. Aside from identifying this is the plant that you need to do, you now need to identify what kind of hypertension do you have. Do you have systolic hypertension or do you have diastolic hypertension? Shall you see now? That is not enough to say, I now bought that and it didn't work. There are herbs that has been documented by scientific evaluation and tested on people that has shown to be effective for systolic hypertension. Systolic hypertension is where the up one is high, the down one is normal. So you have a case where the person has 150/70 systolic hypertension. Then you have diastolic hypertension where the down one is high, the up one is normal. The person is having 110 or 120/110. The systole is normal. The diastole should not exceed 90. In fact, 90 is already getting at the query sign. You see? So, which of these hypertension are you having? This is what a consultation session helps to identify. So, you need to know, to reverse, you need to know which one are you dealing with? Or is it both the systole and the diastole that are high? That is another category. There are other herbs that can work on that. These things I'm saying, these are the things you need to go and find by yourself. If you don't want to do consultation, if you don't want to see a professional, you have to get this information. If not, you're going to put yourself at a risk. Then you need to monitor your vitals. You must check your blood pressure every day before you say you want to stay off, you want to reverse naturally, either with diet and with herbs. You must check your blood pressure or your sugar level or whatever the condition is. You must check. You cannot use natural remedy in ignorance. It's not permitted. You will dabble into toxicity. You will dabble into toxicity. You will thank you so much. You are learning a lot. Oh, thank you so much. Thank you for your feedback. Thank you so much. You dabble into toxicity. You will dabble into side effects. You dabble into damage of other organs. So you find a case where somebody is trying to cure hunchback. You now ended up having hunchback, front back, K-leg, all those problems joined together. You see, problem has become compound problem. So you must be able to monitor. You cannot you cannot do natural remedy in isolation. And that's why when people come to me, I say go and do tests. They be like, why do I need to do tests? I've done. I went to the. I just tell them, I'm sorry. I am a scientist. I believe in science and I use science. When I say that my treatment works, it's not I feel good. It is that you went to do tests. After doing the test, I gave you treatment. After doing the treatment, you went to repeat the test. You now send me the result. This is what I am analyzing. Not I feel good. I feel good is nice, but I feel good is not enough. Because sometimes you may be feeling good and the problem has migrated or mutated into something else and something more dangerous. So we use tests to analyze. So to use herbs, you must be willing to check that. Then, in using herbs, safe way to use herbs, you must use one herb at a time. One herb at a time. Unless you are me, that know herbs, that have studied herbs, that is still studying herbs. I can give a combination of herbs. Even when I'm giving combination of herbs, we run efficacy tests. We run toxicity tests on my products. My products are NAFDAC approved. They are USA FDA approved. The products that we produce in Canada for some kind of health product problems like cancer and some other stages of kidney diseases, liver diseases, We don't produce those. We produce them in Canada. Why? Because the Canadian Health Organization helps me to, they have lab. This laboratory are dedicated to herbal products, to analyze the product, so that when we say that a dosage is 1 tablespoon, we know that 1 tablespoon is equivalent to 10, 20 mils. Now we know that that 20 mils you are taking, it has 100 or 200 or 300 milligrams of the active ingredients in the plant. Remember that when you are dealing with herbs, you are talking about the accumulation of the active ingredients, the compound, the flavonoids, and there are more than 1,000 of it in every plant. So by the time the nutritional value is isolated, we want to be sure that you are not safe. You are not, you are safe. You are not at risk. So you that have not done all those analysis. So when people tell me, the product is, it's just because we did tests. You see, paracetamol that you are drinking, or any antibiotic, or any of the drug you are doing, that tablet you are taking is a formula that has been compounded, that has been analyzed, that has been, they tell you that take 1 tablet in the morning, take 2 tablets. Then when you take 2 tablets in the morning and 2 tablets, you now know that you are taking overdose. The same thing with my herbs. I can't say that for all herbs. I can't say that for all practitioners, but I can say that for myself. So our herbs that we produce in Nigeria, we have to send them to different labs and send them to NAFDAC laboratory for them to do analysis. They did the test. They checked for efficacy. They checked the dosage. They checked the toxicity. You see, Nigerians sometimes they don't hear word. When you tell somebody take 1 tea bag, the person want to try 2 tea bags so that the problem will quickly go. We have to test. Supposing somebody goes to do 2 tea bags, what is the likely risk that can happen? I went that far. And so that's why the dosage is 1 gram per tea bag. I'll tell you, take 1 tea bag. 1 tea bag is 1 gram, which is 1,000 milligrams, which is enough to start the therapeutic work. Remember that herbs have the ability to alter your cellular. That means that herbs have ability to alter cellular activities. It means that when you take a herb in the right way, you will notice it if you go and check in your laboratory analysis and investigation. So the next thing you need to do if you want to use a plant safely, you must use 1 plant at a time. Supposing you want to treat yourself for malaria and you don't want to take malaria drug, you want to use herb. Before you will grind pawpaw leaf, buy this one leaf, buy that. I am now telling you today that that is not a safe thing to do. And then you know what we will do? They will go and carry the whole stem, like the whole stem, they will crush it, put it inside pot. Granny neem, dongoyaro is the most abused plant in Nigeria. And if you are here and you know someone that is abusing dongoyaro, tell them that dongoyaro has the ability, like moringa, to be cytotoxic. That if you take dongoyaro long enough internally, orally, if you take it long enough, you will cause your genetic to have mutation that maybe not for this person, maybe along the line, they may become prone to cancer of the white blood cells. Because you see, neem plant, which is called dongoyaro. By the way, I've done study on dongoyaro. If you go to my page on Instagram, ask Dr. Rita, and if you're not following me, please go and follow me. I talk about herbs. I do scientific studies of herbs. I've done study of dongoyaro, basil, thyme, oregano, different herbs. Just take time. The videos are usually 3, 4, 5, 7 minutes. Watch it and how to use each herb. I've even done on banana. So some people who are hypertensive, some hypertensive drugs like amlodipine, you cannot be taking amlodipine and be taking banana. Your blood pressure will not be all right. That is another day. You see, so if you're on any drug, this is now by the way, if you're on any drug, please, the drug will tell you on the drug, read the interaction. It will tell you, do not take things that have this. These things can alter if they can either cause you to have synergic activity, have the therapy to have synergic activity that will cause the problem to be increased, or they can have antagonizing activities that will make the thing not to work, or it can just become neutral and nothing. So, and then also you may also now also have a case where the person now have side effects. So lastly, how should you take herbs? Never ever allow, never allow anyone to give you any herb intravenously. Please take note. Never ever allow anyone to give you, go to one place, they not tell you safe way to use herbs, right? Never take any herbs intravenously. One, never take a plant that is supposed to be taken topically. Never take it internally, orally. What is an example of a plant that you should not take orally? A plant like Anika, a plant like belladonna. You see these two plants that I'm calling? They are plants that if you even waka anyhow inside farm and you now allow belladonna to prick you, the person can have poisoning that can be equal to death. And I've found a lot of things online that people do, and I just shake my head. So please, plants that are to be taken topically, don't take it internally. Plants that are to be taken internally, you can also take topically. Now, when you are not sure whether you should use, how you should use a plant, do it as an inhalation. When you're not sure, do an inhalation. How do you do an inhalation? Get the plant, boil it, put it inside something, cover yourself in it, inhale the steam. If in the course of inhalation, you are feeling dizzy, your head is aching, know that if you drink that plant, toxicity. But if you want to, so what are the safe ways? What are the safe dosages for plants? I tell you, if you want to do anything by yourself, never take more than 3 leaves. 3 leaves is a normal, three leaves. I didn't say 3 stems. 1, 2, 3 pieces of leaves. Unfortunately, I don't have any leaf with me here. 3 like this. Those are the, just put it inside your teacup. Pour hot water inside. Allow it to steep for like 5 to 8 minutes. It will change color. You drink it in the morning, remember, before food, and in the evening. And I'm going to say to you, in safe ways to use herb, don't try a new herb in the evening. Never start a new herb therapy in the evening. It's in the morning you will start, so that you can observe how it did you. Because if you take it the first time and you know, in Nigeria, a lot of people don't even know what they are allergic to. When people come to do consultation, I'm asking what I eat everything. I say food sensitivity, food allergy, people do not know it. So you need to take the plant. Oh, you don't know belladonna. Oh my God. Okay. All right. I'm going to do a post of pictures of herbs. Where will I post it that everybody will see it now? But on my Instagram page, I will just do a video on top 10 plants that you need to be careful of. Yes, I will do that. And then as I name it, you will see the picture. I may not be able to get the name in Nigeria, but if you see the picture, you will identify it. So I was saying something now. What was I saying now? I've lost my train of thought. So I was talking about safe ways to use plants. And I said that I've lost my train of thought. And I was saying that you should yes, no more than 3 leaves. Yes, thank you. No more than 3 leaves. Yes, thank you. Not more than 3 leaves at a time. And then not more than 5 days. And then you pause for 2 to 3 weeks. Then the following plants can serve as both a herb, a vegetable, and a poison. Lemon. Lemon is a very good plant. But studies have been isolated to show that too much consumption of lime leads to kidney stones. So if you are among those people that will carry lemon, you will now put it inside one jar, 1 big liter of gallon of water and you put mint leaf inside and you are feeling high, hello sir and hello ma, you are at risk for kidney related problems. Number one, I need you to understand that when you soak a plant inside of water for more than 10 minutes, it has changed in chemical composition. It is not the same plant. It is not the same benefit. What you are already doing is you are already doing a period, you are already engaging in a process. Is it titration they call it, or what do they call it? For lack of, I'm not able to remember. You are already forming a tincture. So you cannot carry mint, basil, all those things, put inside gallon or put carrot, then put you say I just cut cucumber. It is no more cucumber. But you have now formed something else that when you do it long enough will cause problem. So, my dear brethren and sisters, I believe that I've been able to teach you this evening things about herbs that you didn't know. And I'm going to leave us with this and take some few questions before I go. I'm going to say to you that herbs are fantastic. Herbs are good. Never ever engage in the use of any herbs when you have not done your test results. When you want to treat yourself for one problem, you will go and do test. The same thing should apply when you want to use herbs as a therapy. And that's one of the challenges I usually have with people who I say, come and pay for consultation fee. They say, I know what is wrong with me. And I tell them, since you know what is wrong with you, why has the problem not gone? Or they come and tell me, the doctor said, the doctor did not see a vision to call you to say, Mr. John, come now to my office. You had a problem that took you to the doctor's office. So what does my consultation seek to find? I seek to find what was the signal that your body was giving you that was strong enough and discomforting enough to make you go to the hospital. Why did it start? Because you see, chronic problems are problems that have any problem that passed 1 month, it has become chronic. Any complaint that passed 1 month has become chronic. And diseases change in form. So a problem may start as itching. Then it has now migrated from itching, it has now migrated to big boils. The person is no more remembering that it started as itching. Is now saying that I'm having boil, I've rubbed this, it didn't go, but it started as itching. His history taking and consultation will help me notice that it was itching. So it was a sensitivity. When your immune system is giving you symptoms that you have crossed the line, it will bring signs like headache, signs like tiredness, signs like change in dizziness, signs like fatigue, signs like taste. These are symptoms of malaria. Instead of you to sit down and let someone analyze you, no, you go straight and go and buy you can't buy drug or you take one thing. What do? You now cause that response of the body. The body will now change the response into something else to respond to the new drug you have brought. That's why chronic problems persist. And that's why I'm a specialist in chronic related problems. Aside from the fact that I studied, it's also a skill that God gave to me. It's also a gift that the Holy Spirit gave to me. To be able to, it's a very special gift to be able to know what the problem is. And that is the first thing to finding which plant will work for you. And in dealing with plants, no two people respond to the same plant in the same way. So on the 30th of January, I'll be in Lagos. I'm based in Abeokuta. My name is Dr. Rita Jabin. I'm from Delta State. I'm based in Abeokuta, Ogun State. I'm a naturopathic doctor. By that, it means that I went to school, I studied, and I can use plants. I know plants and I can use plants to reverse chronic illness. Now, sorry. Sessions are effective and sessions can be done online. So if you want to catch me, you can catch me on the numbers that are showing right on the chat group and in the screen. We have some few minutes left because I don't want this program to exceed 1 hour. I'll see if I can also go live again next week, Sunday, because but for that one, I would want to take questions ahead of time. If there are some particular plans or if there are some particular things you want to clarify, you can send it to the numbers, and then I would now prepare those answers for those questions, and I will now talk about some plans for some different things. So let me leave you with a plan this evening, but I'm free to take any question now. If you have any question, you can just unmute yourself and I will ask, because we have just less than 7 minutes to the end of this program. I believe that you have learned something. There's someone in your GM that needs my service. So please tell them about Dr. Rita Jabin. Okay, so please kindly unmute yourself and you can speak. But while I'm waiting for someone to speak, I would want to say that I want to leave you with juicing. This is the full free part of it. Juicing. Okay, please unmute yourself. I'm trying to open. Okay, you are saying what? Can you say that again, please? What do you mean? Okay. Okay. Yes. Yes, please. Thank you very much for a very fantastic question. So you see, you don't have to be taking all those plenty things. You don't need to cleanse your system. You don't need your liver. That is the job of your liver. That is the job of your kidney. If your kidney functions are all right, your liver functions are all right, your cholesterol, your parameters are all right, you don't need to take any moringa, anything. No, you don't. You don't. You only need to eat and eat enough vegetables and eat enough fruits in their natural state. You don't even need to take supplements. There's a lot to say, but you don't need to. Just leave your body as it is. Sometimes the acne that people are battling with, the restlessness, the problem is from the interaction of consuming too many things over a period of time. Someone asked me a question and they said, can I what's my thought about supplements? And I said, no, I don't advise supplements. And they were like, why? I said, because it's a supplement. Supplements are supposed to augment for food, and you usually require it in the period where there is convalescence, where somebody is recovering as a result of illness, long-time illness, or some diseases. Those things become necessary. But what do you have? You have the person did not, instead of choosing to eat well, he just said, I have vitamin C supplements. Where they drink. I have this supplements they take. I have that one they take. We should only be going into all of all that as a response to a deficiency, not as a means to keep yourself well. No, no. These things over a period of time cause problem. So, Madam Ifi, please stop everything. And please remember, I don't know whether you joined me when I said it. The study is there. This particular study was not even done outside of Nigeria. It was done in the University of Lagos. Professors, I participated in the study. I was in the meeting. I paid money for it. Please, understand that moringa is a cytotoxic plant. It means that if you take moringa long enough, it has the ability to cause a genetic mutation in your cells of your body to cause the person to be cancerous. And I know more than 5 people who have cancer from long-term use of moringa. The study is available. You get up and go to University of Lagos, go to Akeda, the department, go there. You see it. It's there. So, ma'am, nah. So don't forget that a lot of all these things you see in the market don't contain the things that they say they contain. Don't have therapeutic analysis done on them. They are registered as food grade. Because they are registered as food grade, they are categorized under food. They are registered as food grade. That's why they are like that. Do you understand? And I can tell you, I've gone through NAFDAC. To the best of ability, NAFDAC is trying. But when a plant, a herb, they say you're taking green tea is not, there's no plant called green tea. Green tea, every plant, most of plants are green. You need to find out what is the herb in particular that is in that thing. Are you sensitive to it? Do you see? So you know I'm waiting for your own test result to come out. You have done part A of the consultation. Part A is we talk. Then I send you to do test. I sent you to do renal function test, kidney function test, EGFR. EGFR to take the stage of your kidney. Why do I ask you to do that test? I want to find out what the impact of all the things you have been drinking, the juice and everything. What is the impact on the organ that is directly responsible for filtration, which is the kidney? You will find that people who are not hypertensive, who are not diabetic, they don't have any problem. Their kidney function is below, they are in stage 3 kidney disease. They don't have any problem. Their leg is not swelling, but their kidney is at instead of something that is supposed to be like 90 and above, they are like 35. They are stage 4 kidney disease. Battling with kidney disease, like some, and they don't know. The only thing they know is that I'm always feeling tired. I have bitterness in I have pain in one side of my body. That's all they experience. So when I ask you to do EGFR, I want to find out. That is a test that tells me how much Dr. Google has impacted on your organ. So, ma'am, I believe I've answered your question. When your result shows that you need kidney therapy, you will get it. If you don't need kidney therapy, I will not give it to you. Because like I said, they are therapeutic. So yes, the person can get the health combo for kidney. He will do the consultation session, and then we will check the impact. Of course, in cases like HIV and all other conditions that have to do with the immune system, they have the ability to impact on the organ. So we check on the organ and prevent it. So yes, the combo is available. The health combo is 95,000. That means you get 30 minutes consultation, you get 6 weeks treatment, you get list of what to eat and what to avoid. But if you do your consultation session and we tell you that the problem is not a 6 weeks problem, you will still be told. Yes, I will tell you. But if you say you don't want to do consultation, you just want to buy products, don't come and ask me question, how long can I use this? How do this? No. You will have to get the food plan. I give you a food plan based on the consultation. So for that person, yes. So Madam Comfort, please, you can kindly unmute yourself and ask your question. Mr. Comfort,